Good day. My name is Kurt Gillen with Aegis Therapies. I'm your wellness instructor. And our topic today is identifying fall risk, strategies to prevent falls. What is the leading cause of fatal and non-fatal injury among adults 65 years age and older? Is it A, motor vehicle accidents, B, suffocation, C, falls, or D, fire and burns? Well, you guessed it, C, falls. Falls have a huge impact on one's quality of life. That is why we always encourage you to talk to your doctor before you start a fall prevention program, or at least inquire, as they can help you navigate this terrain. It has very different things you can work with in terms of medication, your shoes, a variety of factors, and your physician will be glad that you took the time to invest in fall prevention. Fall prevention is an issue with older adults, as most falls go unreported. In 2014, there were 29 million falls and over 7 million injuries. And that was with 46 million people, and that was what was reported. In 2030, we're anticipating over 49 million falls. That's 20 more million falls and 5 more million injuries, and an increase of almost 30 more million people. Falls can be classified into 3 types. Physiological fall, which is anticipated, and these mostly occur in nursing homes, hospice, or in hospitals. This is when a patient is more likely to fall, regardless of the surface and if they're on their own. The physiological, or the unanticipated fall, is number 2. It can be caused by unexplained dizziness, as well unconsciousness and faintness. These are falls we just don't anticipate if we stand up too fast or anything like that. And the third category is accidental. It's universal. Sometimes, regardless of the surface, regardless of a terrain or shoes, regardless of any of those things, sometimes we just fall. Now, did you know, and this is not a great fact, but it is true, that every 20 minutes an older adult dies from a fall in the United States? And we like to say that that is what is reported, because the statistics show that a great deal of falls aren't reported due to embarrassment, due to injury, someone being by themselves, or something being taken away because that person falls. That's why, regardless of any type of fall, we want you to report it. Now, we have different risk factors for falls. The intrinsic risk factors are as follows. They're age-related, impaired sensory, or medical. For age-related, we're looking at muscle weakness, gait and balance disturbance, and decreased body weight. These are all part of a natural age-relating process. For impaired sensory, we're looking at peripheral, we're looking at appreciation, as well as vision, hearing, and impairment. And for medical, we're looking at dizziness, cardiovascular, and neurological conditions. These can be conditions that are outside of our control that happen with our body. Now, the extrinsic or the external risk factors are as follows: medication, personal factors, and environmental hazards. We want to focus real quick on environmental hazards, as that can be due to rugs, lighting, cords. If you have pets, it can be something on the floor that you just don't see. And those are a lot of ways that people fall, as well as with the medical and the personal. But again, the environmental factors are things we have control over. And that's what we want to make sure that we do, control our environment. Ah, yes, Mrs. Doubtfire. She was one spunky lady. Now she looks like she is in the best shape of her life. But let's look at Miss Doubtfire a little bit more. Let's look at the case study on her. She's 82 years old. She lives alone, right? She takes her daily walk in the neighborhood and she takes care of her grandkids, right? but she's had diabetes and she has chronic numbness in her feet. Now, she's on medication for high blood pressure and uses Tylenol PM. Now, we don't know when she takes the Tylenol PM, but we know that can have an effect possibly. And her daughter is very proactive. She subscribes to a newsletter about better health for aging parents. And she does read the CDC fact sheet on fall prevention. And she wants to keep her mom from falling. So, of all the categories we just read with Ms. Doubtfire, what do you think would be a reason for an alarm? Now, the chronic numbness in feet, we really can't control that. The diabetes as well. Now, we would look at taking Tylenol PM if that's the only medication in the house. She may take it during the day, or because it does have those properties that help you go to sleep, you want to make sure that you just don't jump up when you get out of bed if you're taking Tylenol PM at night. But the most important risk factor is the blood pressure medication. That can have a huge impact on how she may walk, her gait, and how, if and when, if she ever falls. So as great as Miss Doubtfire may be in terms of being in shape and active, the blood pressure medication is something that she would want to bring up with her doctor or her daughter. Now, there are 3 components of a fall prevention program. Education, what to do. We always recommend, again, that you go to your physician first. If you're in a wellness center, we advise that you reach out to your wellness coordinator or wellness director. If you're in assisted living, reach out to the nurse or anybody who's involved in the kind of programming that would be for falls or any type of exercise or strength building classes, as well as your therapist. But we do recommend that you reach out to your physician first. Behavior change. Help you take action. Sometimes falls can be out of fear. If you fail once, you may have a fear of falling again. So what we want to do is examine, how did you fall? And try to eliminate the risk factors around you that led to that. If it's fear, we want to make sure that if you're walking, you can overcome that fear. It's a variety of reasons, but behavior change, changing the way you think, taking control of yourself, taking control of your actions and your environment will build up a confidence in you. That doesn't mean you won't fall, but you may be less likely to because you've cleared the necessary hurdles outside of anything that's a natural, universal event. Exercise. We recommend that you take exercise at least 3 times a week for a minimum of 30 minutes. But activities are just as important. Whether you're gardening, washing dishes, taking the dog on a walk, or taking a walk yourself. Just being active around the home or outside the home if you have the opportunity to. Exercise is a great way to build up the muscular strength that you need to prevent falls. You may not be able to move around much, but there is even chair exercises that you can do for your legs, your core, as well as your upper body to help you to prevent falling. Now, fall prevention is 6 simple tips we want to give you. Please pay attention. The first is wear sensible shoes. Sounds crazy enough, but we want to make sure that we have on shoes that are going to be conducive to the ground that we walk on mostly. So that means you may want to go get yourself fitted for a nice pair of sneakers. We can't advise whether it's Velcro or lace, but we want to make sure that your shoes are okay. Some people are wearing sandals or flip-flops. We recommend that you have a shoe that has some type of adhesive or some type of rubber that can grip the ground pretty good, as opposed to just regular shoes. A doctor's appointment. Like we said early on, we want you to check in with your doctor first to let him or her know that you're interested in a fall prevention program. And they are an excellent source and can guide and lead you in the right direction for that. Keep moving. Physical activity can go a long way towards fall prevention. Just like exercise, you can also be active by moving around and doing different activities. And we encourage you to be in move mode. That means if you're resting, get up, take a stretch, move around a little bit, walk around your chair, walk around the table, or walk around the house just to keep the blood and the oxygen flowing well so don't get stiff or any kind of cramping or anything like that. So when you stand, you'll be okay. And removing the home hazards. Again, plugs on the floor. It could be a carpet that doesn't go too well, right? It just moves around too much. We want to make sure that in your home that there are hazards that you can clear away. Now, before you begin that, you may want to check with your loved ones, family, friends, depending on where you're staying, and have someone come in and take a look around just to make sure, a professional, of course, but to come in, take a look around, and make sure your home is pretty fall prevention safe. That doesn't mean you won't fall or it won't stop you from falling, but we want to take those necessary precautions to make sure the place that we live or the place that we are the most is going to be more conducive to us having a normal walk and less falls. And lighting. Lighting is very important. Some people fall because in their homes, no matter where they stay, they feel they know it and they can walk around with their eyes closed. Well, sometimes if something is not well lit and you have a hazard on your floor or in your path, that can cause a possible fall. So you want to make sure that you're always in a well-lit area when you're taking a walk around your home. And don't take for granted that you know your home so well where the eyes can be closed, figuratively. That's extremely important. And we also recommend walking aids. Nordic type poles are great for walking. They're called walking sticks. You can adjust the height. They have a great rubber bottom. But you can also use very nice canes or single walking sticks as well. Anything that's going to help you with your balance. If you're doing a lot of walking, we recommend walking sticks because the terrain can change, the incline can change, the decline can change. And these will help you with your balance. So you're never too old to set another goal or to dream a new dream. That's by C.S. Lewis. And what we want to say to that is we want you to be well, to walk well, not fall, and take the necessary precautions. And don't feel like you're going to be cheated out of life because you did take a fall. It's okay to dream. It's okay to want to live a healthy, fit life, regardless of your age. Thank you very much. This concludes our identifying fall risk and the strategies to prevent falls. My name is Kurt Gillen, your wellness instructor. Thank you very much for tuning in and have a great day.